Breast cancer is the second most common cancer among women and the second leading cause of death among women in the United States. For non-Hispanic Black women and Hispanic women, breast cancer is the leading cause of cancer death. Affinia Healthcare is exploring the journey of three staff members as they share their personal story of being diagnosed, receiving treatment, and winning their battle with breast cancer. According to ABC News, the number of women being diagnosed with breast cancer at a younger age is growing, leading the U.S. Preventive Services Task Force to lower the recommended age for getting a mammogram from 50 to 40. In our first segment, we discuss the age they were diagnosed, how they discovered they had cancer, and how they advocated for their health.
I was 50 years old.
I believe I was like in my mid-30s, early 30s, mid-30s when I was first diagnosed with breast cancer.
I was 33 years old.
I had chest pain, and it was chest pain, and it was radiating down my left arm. So, of course, and this was me just leaving work one evening, and I was like, chest pain, and it just came all of a sudden. And I was driving, and I was thinking, like, should I pull over and call 911, or should I take myself to the nearest ER?
Well, actually, I found out by doing a self-breast exam myself. So I was just laying in bed, just doing my exam like I would normally do, and I felt something felt different. I was always told that I had like fibrocystic breast disease. I'm thinking like, okay, just a cyst, whatever. But this particular thing felt funny.
I was pregnant with my daughter, and I had found a lump or felt a lump in my breast. At the time, I was going in for regular OB checks and had spoken with my OB several times about the lump.
They found a mass on the CT scan, and so then I had to go and have another mammogram, which confirmed that it was a mass. I had a mammogram and an ultrasound, and they confirmed that it was a mass. Uh, maybe a week after the mammogram, I did go in and have a biopsy done. And the biopsy, they told me it was breast cancer.
So I called my OBGYN. He had me to come in to get an ultrasound. And once he couldn't feel it on his exam. So he sent me to get an ultrasound. So when I went to get the ultrasound, I got a phone call to confirm that it was cancer.
So I formulated a plan that I was going to, show him at my next appointment, and ended up flashing him, which is what I call my Mardi Gras moment. And he took one look at my breast, and kind of his eyes did one of those things, and came back 20 minutes later and was like, "Hey, I need you to go for an ultrasound." So my course was the next day. Got me in, and I had an ultrasound, I had a mammogram, and I had a biopsy all in the same day, and that was December 19, 2008.
Being comfortable with your body and knowing your body is key to being your own advocate. Family nurse practitioner Don Patrick strongly suggests young girls and women become familiar with their body so they can speak up when something doesn't feel right.
I think that if we get comfortable touching our breast and knowing what something abnormal feels like, if we start early in our practice, then it really helps us to be advocates early. My OB originally thought that it was my milk ducts because of my age. When I asked him, why didn't you even look at my breast? And he just didn't think that I was an at-risk person. But being an African American female, we tend to get breast cancer at a very younger age, but we're also more likely to delay treatment because we don't think that it's anything wrong, or we're told that we're not within the age range for breast cancer. So my advice to young girls and women is to do self-breast exams. It's very easy, and we know when something is wrong, and to be your advocate, be your own self-advocate. That's probably the best advice that I can give anybody, is to make sure if you feel something, say something.
Stay tuned for the next segment as the ladies discuss their feelings and the steps taken for treatment. Affinia Healthcare is partnering with BJC Healthcare to provide mammograms to our patients. To find out if you're eligible, please call 314-814-8552.